the United States officially completed its withdrawal from the World Health Organization, bringing to an end a nearly 80-year membership in the United Nations global health body. The move marks one of the most consequential shifts in global health governance in generations, raising concerns among health experts about future pandemic preparedness, global disease surveillance, and the ability of nations to coordinate responses to major health emergencies without U.S. participation. The withdrawal stems from an executive order issued by President Donald Trump on January 20, 2025 at the start of his second term. That order set in motion a year-long process that culminated this week, fulfilling the notification period required under WHO rules. U.S. officials had already stopped funding the WHO, pulled all personnel from its Geneva headquarters and other offices, and ended participation in WHO governance, committees, and technical working groups as part of the withdrawal process. The U.S. government has argued that the WHO failed to adequately manage the COVID-19 pandemic, lacked transparency and independence, and was too susceptible to political influence from member states. In announcing the completed withdrawal, the Health and Human Services Department and the State Department reiterated that the United States plans to lead global health efforts through direct bilateral engagements with individual nations and other partners. Global health experts and WHO leadership have strongly criticized the U.S. departure. They warn that losing the world's largest historical funder and a founding member could weaken the WHO's ability to coordinate responses to health emergencies, such as outbreaks of Ebola, polio, and other infectious diseases. Critics also stressed that U.S. scientists and public health agencies may now face restricted access to critical global health data and collaborative platforms, potentially hampering vaccine development and disease surveillance efforts. The WHO itself has expressed regret over the U.S. decision and hopes for constructive dialogue and future cooperation, emphasizing its role in protecting health worldwide and the long-standing partnership the two sides shared. As the world adjusts to the U.S. absence from the WHO, the broader impact of this historic move is still unfolding. What is clear is that the global health landscape has shifted, with consequences for international cooperation, disease prevention, and how the world prepares for the next pandemic.
If you like this video, then like, share and subscribe to Mirror Now.